Hello and welcome to the CDO Magazine interview series. I am Pat Haller with CPC. Today I have the pleasure of speaking with Brian Shea, Chief Information Officer at MedOne Healthcare Partners and Interim Chief Information Officer at the Lexington Clinic. So Brian, pleasure to be with you this morning. Excited to talk to you.
Thank you. Thanks for having me.
Absolutely. So Brian, today, we're going to talk a little bit about innovation, digital transformation, talent recruiting, things along those lines. But let's start maybe on the innovation side. Like just simply how do you guys define innovation within your organization?
Yeah, so that's a good question. I know a lot of people talk about being innovative and how do you be, how are you innovative, as, an individual, a group, or an organization. Innovation in our eyes here, especially at MedOne Healthcare Partners, is really, it's not just about technology, right? Mm-hmm. So innovation doesn't have to be tech, right? Tech might be a big part of it, for sure. But innovation in our eyes is really about the process of thinking about things differently, right? Either something new, right? Making a change, right? Mm-hmm. So let that be in operational procedure efficiencies, right? Looking for opportunities there. How do we become more efficient with something? Being in a healthcare organization, it's always about, for us, patient experience, right? And mm-hmm. for our customers, which are our health sites, hospitals, and other facilities and stuff. So how do we deliver something better? How do we have better quality results? What can we do to improve, the care experience with it? So that could be through technology, that doesn't mm-hmm. exist, today maybe. So innovative thought of doing something differently to, drive a result that we're looking for, or make the process of the provider easier, right? So they could deliver better care, so mm-hmm. we look at those things. But again, even on the back office operational side, how are we again more efficient? How do we look at ways? How do we use data, right? Mm-hmm. To drive our decision process. So being innovative for us is, really thinking about things again, more of what are we trying to do and how we're trying to resolve it, and then we look at, can we leverage technology to facilitate that?
Okay. Awesome. Another term that gets tossed around a lot, digital transformation, means a lot of things to a lot of people. What does that mean at MedOne Healthcare physicians?
Yeah. So when you say digital transformation, I kind of laugh a little bit too, because I know there's a lot of talk of people are saying, well, everything's digital, right? So if any change is digital transformation, right? So I think it really depends on the level that you're approaching it as a group and how it kind of folds into the scope. A transformation is a change, right? Mm-hmm. Of something. So you might be it might be a jump start of, hey, we need to look at technology as a whole, for an organization and how we deliver our services and how we operate. And it might be at that level that you're looking at it and coming down through to digital transformation might be as simple of, again, how do I leverage technology to do something just different, right? Mm-hmm. As we kind of talked about on the innovation side, they kind of blend together, right? A little bit there. But on the digital transformation, we might have a process that we're doing and we have tech in place for it. But mm-hmm. yeah, maybe that tech, we're trying to use that tech in a way that it doesn't make sense anymore, right? Things have changed. So how do we, how are we making sure that we're leveraging technology to our advantage as well? So when I think of technology transformation, it's also how are you maintaining relevance, right? Mm-hmm. So how are we being competitive in what we do? Because at the end of the day, even being a healthcare organization, we're still a business, right? Mm-hmm. So we need to operate efficiently. We need to figure out what is our competitive advantage, right? To others that might be in our space. So digital transformation to me, means how do I, also how do you work smarter, right? Mm-hmm. At the end of the day, we're a 200 plus organization, from a MedOne Healthcare Partners side of things, and my IT is relatively lean, mm-hmm. and we have to make sure that we're leveraging technology that's available to us, mm-hmm. To improve, make us more efficient, make us work smarter, allow us to focus on the things that we really need to focus on as an organization to drive business forward, mm-hmm. right? Or improve care or whatever, and not be tied down into the weeds of operational activities in IT, right? So digital transformation might be changing the tech stack, right?
Mhm.
As a whole, in your organization to make you operate more efficiently.
Okay. Well, and you alluded to this, Brian, really the tech in which your team is really helping to drive outcomes for the business. You're not doing things just because it's the latest, greatest thing. But
Right.
when you're working with how are you communicating kind of the organization's vision around innovation and digital transformation? How do you kind of transform or communicate those outcomes into, okay, how do we impact that as an IT organization?
Yeah, that's a good question. And it's a challenge, as like in many organizations to, have that message. MedOne Healthcare Partners, we are fortunate. Our organization was really created by a technologist and a provider initially, right? So they've really had at their core roots have always embraced technology, right? And leveraging technology. I think you start getting into what is good enough, right? And I have a phrase that I like to use, just because you can doesn't mean you should, right? So you can customize everything, right? And you can custom develop everything to meet your specific requirements, but does that make sense financially, right? To do that. So I think it's, we meet as a leadership team. We kind of lay out our priorities. We just recently kind of started that transition again this year of, what are our business priorities, right? Then what's our business strategy really, right? And then how do we drive in IT strategy? Really, they should be intertwined, right? With your business strategy. They shouldn't be two separate silos, right? Of I have an IT strategy and I have a business strategy, right? They're really one. And I think we're an organization, I think that does that well, and intertwines those. I think, companies do struggle where they look at those in silos and then it's kind of treated that way and then priorities don't align and stuff, right? So I think it's, we have a good base. We had a good starting base here, just culturally ingrained how we operate, with IT change, but we're very, my leadership style is being very transparent. My team is very transparent. We're very, good or bad, putting information out in front of there. And I think in our way that we delivered is making it real, right? When we go to, IT leadership, or it has to go to the board in some instances, depending on what it is and what we're working on, is how do you make it relevant? So, we use scorecards, like on instance on the security maturity type, we created a security maturity scorecard. It's a red, yellow, green. It's easy to follow, where we're at, as an organization versus getting into, if I had a full blown NIST report that I took to them or assessment, security assessment based on the NIST framework, I'm instantly going to lose them when I start talking like that, so, and that's so just not like security, but any project that we approach is what does it mean? What are we trying to do? What does it resolve? Making it very relevant, to our leadership team. And then that way it's really made the buy-in a lot easier. Right. I think we've gotten a lot better, over the years of showing true ROI on things. And that's difficult sometimes when you're a custom application, you do a lot of custom application development because it's evolving, many times. And you have to be careful of putting too many guardrails around something and stifling innovation, right? And change versus, but yet you still have to have some guardrails that you don't, just spend infinite amount of money and resources on something, and do you ever get to where you want to be, right? With it. So that's a balance, but I think we do a good job of balancing that here of, our initiatives, what we're trying to do and what the value is.
Awesome. And you kind of alluded to, led me down the next question. So you mentioned like on the security side of things, you guys do a green light, yellow light, red light from a KPI or metric perspective. How do you guys internally as a team, how are you measuring, innovation and digital transformation? Do you have metrics that you're leveraging and using? What do you use to kind of create those guardrails? How are you kind of maintaining that?
Yeah, and that's a challenge. I think for a lot of organizations, I think, one aspect of it is in the results, right? That's an easy answer, right? Kind of to it of, are you seeing the results that you were expected to have as an outcome when you started down this journey of whatever it is, right? On the initiative. Dollars, those are easy, right? If you have a framework of dollars, you can at least say, here's what was budgeted and here's when we were expected to go live. So we do measure, was it on time? Was it on budget? Kind of conversation. So that way we don't have creep right? Of maybe a project or initiative that we're doing. And that's something that is reviewed and pulled back into, especially if it's a board approved type initiative in the organization, it has a lot more eyes than, on it, of course, at that time. And there's reporting back at different points, right? So we do a lot of things in phases, a phased approach, as well. So, phase one is here's the definition of a phase one, and here's the costs associated and what was approved. It's easy to report back on that kind of thing with it. Security, I always joke on this is, the biggest one is I don't want to wake up and be on the news, right? That's the best outcome, right? On a security thing of how you're doing. But there again, it's incidents, where I see where we do well in security is I'm really big on, I talk a lot about on this, but I talk about people, process, and tech. The three pillars, really there. And I think all of those have to align and balance, because if one gets off kilter, you kind of go different ways, right? So like from a security perspective, you have to have good tech in place and help to mitigate or minimize the amount coming in. I never use the word prevent because I don't believe there's 100% prevention, right? So, but you have to have good tech. So that's the tech pillar. Then once something gets in, into your environment, you have to have good education. So that's that's the people aspect, right? So awareness and things like that. So where I gauge success there, in the metrics are people coming to us? Are people actually seeing something, questioning it, and raising it to attention? That tells me we're winning on the awareness side, right? If we see a shift, people actually not being afraid to communicate. And then you have to have good tech on the other side. You have to have good processes, of if something does happen, and good tech, if somebody does click on something or something, then preventing it from going back out, right? So the metrics for me are at those different touch points. Do I see change? For us, it's very outcomes driven, right? Are we seeing the results that we expected to see? Is it making something easier, right? Does it allow a provider to operate more efficiently, and maybe it's see more patients, right? So there's numbers and data on that side. Or you could get into quality type things, that hospitals are really big into, like readmission rates and stuff like that, right? And then, if you could use data to kind of see how, of the care that we're providing in one area, is that preventing readmission potentially, back into a hospital? That data is there, right? So we could use that data to see changes that we make. Does it improve that, right?
Awesome. When you've kind of touched on it a little bit in terms of, some of the feedback and metrics, why, these topics are so important, but talk about it maybe bigger picture in terms of the market that you're in, the business that you're in, the clients you serve. Why is innovation and digital transformation, why are these topics important to you?
Yeah, so healthcare is really transforming right now, right? So healthcare delivery and experience from, the old bricks and mortar hospitals, right, to, provide. So you have health systems, you have private provider practices, you have private equity firms or VC backed, firms that are, doing a lot of mergers and consolidations and things like that. A lot of it is about costs. Everybody, wants things done for less, right? And have a higher profit, right? In what they do. So I think in healthcare, the bigger thing that we're seeing from a transformation, from a technology perspective, is you see players like Amazon and CVS or insurance providers that are getting now into the healthcare space, right? So like an Amazon isn't providing providers per se. They're not experts necessarily on providing care. What they're experts on is delivery and customer experience, right? So they're using their technology platforms and experience to provide that better experience. I think a lot of people talk about, you could order a pizza from Domino's, and you can see from the time that you order it, from the time toppings were put on, from the time it was put in the oven, to the time, it's being driven to you, to the time it gets to your door. Why can't the healthcare experience be the same way, right? So I think, consumers, like us, right, are looking to healthcare to figure out, why can't my healthcare experience be as easy as ordering a pizza, right? And know where I'm in my healthcare journey. So I think you're seeing a lot of transformation in technology and tech coming into play on the whole logistical side and customer experience and delivery of things. And everybody's having to do that, or you're gonna not be relevant. I use that word, maintain relevance. As a group or an organization or a hospital even, you're going to struggle to maintain relevance if you can't continue to change on how we're delivering care, better care, quality care, effective care, cost value, those kind of things, you're going to struggle, right? And people have to leverage technology to be able to do that.
Well, thank you, Brian, for joining me today. It truly was a pleasure. And please don't forget to visit cdomagazine.com for additional interviews. Again, been a pleasure. Really enjoyed our conversation today.
Thank you, Patrick. I've enjoyed it as well.